Hello viewers, welcome to my channel. So today we're going to talk about low urinary tract infections, and this lesson is made in a familiar way for you to understand, and hope at the end of the video you'll be well informed because you know better to do better, and prevention is better than cure. Without further ado, let's get into it. So the common LUTI, or rather low urinary tract infection, is the cystitis and urethritis. Okay, to start us off, cystitis is the inflammation of the bladder from any cause, but most often is secondary to bacterial infection. The causes are E. coli and Pseudomonas aeruginosa. The signs and symptoms may be dysuria, which basically means pain or burning sensation on urination. Then the frequency may be increased, maybe more than once every 3 hours. Then the urgency is so urgent, yani you really feel pressed. Then feeling incomplete voiding. Then cloudy urine, which may be caused by accumulation of bacteria and pus. Then hematuria, which is blood in urine. Then lower abdominal pains. Okay, this cystitis is classified just as any other disease. It's acute and chronic, and just like any other, acute means the sudden occurrence of a disease. So this is the inflammation of the bladder and may be due to 1. Spread of microbes that are commensals of the bowel. Commensals are the normal flora, which is normally E. coli from the perineum, especially in women because they have short and wide urethra, and the proximity to the anus is so close, and also the moist perineal condition supports the growth of the bacteria. Number 2, a mixed infection of coliform and other organisms which may follow passage of urinary catheter or other instrument. This is as a result of instrumentation, maybe catheter, or maybe insertion of radiotherapy or any other visual investigation thing. Number 3, inflammation in the absence of microbes following radiotherapy or passage of catheter or other instruments. The effects are inflammation, small hemorrhages of the mucosa, which may be seen as hematuria, then pain. So after the traumatic experience of maybe passing catheter or other instruments, that's the reason why this patient will present with hematuria. Then pain. Pain is as a result of hypersensitivity of the sensory nerve endings in the bladder wall, and this may be experienced or felt before the bladder is filled, thereby causing the patient to present with frequency in micturition and dysuria, which is burning sensation on micturition. So the urine may appear cloudy and have an unpleasant smell. Lower abdominal pain often accompanies cystitis. So the smell is as a result of the growth of bacteria, and the lower abdominal pain, of course, as a result of hypersensitivity of the sensory nerve endings in the bladder. On the predisposing factors or the risk factors, there is coliform microbe in the perineal region. Then stasis of urine in the bladder, especially in pregnant women, because the progesterone normally makes the urethra to relax and or kink, causes kinking of the urethra. So there is probability of stasis of urine. Then during sexual intercourse, especially in female, because there may be trauma to the urethra and maybe transfer of microbes from the perineum with the male penis. Another risk factor, hormones associated with pregnancy cause relaxation of perineal muscle and relaxation and kinking of the ureters. Yes, just as I said, the hormones produced in pregnancy, the progesterone, cause the kinking of the ureters. So it's difficult for the urine to pass through the ureters and flow out. Then towards the end of pregnancy, pressure caused by the fetus may obstruct the outflow of urine. This is in the third trimester when the pregnancy has become so big. So when the baby is progressing to go down, it reaches to a place where the baby's head is on the presses on the bladder and the ureter and the urethras, such that there's a dysfunction in the, or not to call it dysfunction, but difficult in excretion of urine or outflow of urine from the urine system. In male, prostatitis provides a focus of local infection, or an enlarged prostate gland may cause progressive urethral obstruction. So, unlike in female, the males have the prostate gland, which is at the neck of the bladder. So, when this enlarged, which is a common case in male, when they reach a certain age, there's normally the enlargement of the prostate. Not in all male, but most of the male, there's enlargement of prostate. So when it is enlarged, it blocks the flow of urine from the bladder, or it makes it difficult. So there's accumulation or stasis of some urine, which provides a good space for the bacteria to grow and grow. Yeah. So viewers, we want now to talk about chronic cystitis, which is chronic means the repeated attack of acute cystitis. So it occurs most commonly in males over 60 years of age, when compression of the urethra by an enlarged prostate gland prevents the bladder from emptying completely. Calculus formation is common, especially if the normally acid urine becomes alkaline due to microbial action or kidney damage. Yeah. On diagnosis, you can diagnose based on symptoms, and to add on others, you can do urinalysis, the midstream specimen, then culture to identify positive organism. On treatment, you can, in acute, you use ciprofloxacin 100 to 500 mg BD for 3 to 5 days. This is a very good drug for urinary tract infection. Then nalidixic acid 500 mg to 1 gram 4 times a day for a week. In chronic, you use cefadroxil, which is a cephalosporin 500 mg to 1 gram 2 times a day for 5 days. The second condition on the lower urinary tract infection is the urethritis, which is the inflammation of the urethra. A common cause is Neisseria gonorrhoeae, spread by sexual intercourse directly to the urethra in the male and indirectly from the perineum in the female. Many cases of urethritis have no known cause, i.e., non-specific urethritis. On clinical features, it's categorized either gonococcal or non-gonococcal. So in males, inflamed urethra, then fasting urine, then there is polyuria, which is passage of so much urine, which occurs in 3 to 14 days. Then there is prostatitis and epididymitis, which is inflammation of the prostate and inflammation of epididymis, respectively. Then there is dysuria, which is painful menstruation. In females, there's discharge, which is not always and not all the times. Then lower abdominal pains, and pelvic inflammatory disease. On non-gonococcal urethritis, which means it's not caused by Neisseria gonorrhoeae. So in males, there's mild to severe dysuria, pain in urinating, then scanty discharge. Then on females, there's no symptoms before pelvic inflammatory disease develops. On nursing management of a patient with low urinary tract infection, both cystitis and urethritis, you first administer antibiotic which we mentioned earlier. You can use nalidixic acid, 500 mg for 7 days, 4 times a day, or you can use nitrofurantoin 100 mg 2 times a day for 5 days. Then encourage plenty of fluids to promote urine production, thus clear the urinary tract of bacteria. Plenty of food is encouraged. Then you administer anti-inflammatory analgesic. You can use brufen, which works so well. Then advise patient to avoid irritants like caffeine and spices. Then provide privacy to the patient. Health education on predispositive factors and causes, proper hygiene measures to prevent recurrence of infection. Void every 2 to 3 hours and completely empty the bladder to prevent stasis and infection. Teach patients self-care and prevention methods. Perineal hygiene, increase fluid intake. Avoid coffee, tea, alcohol as they irritate the urinary tract. So we have talked about the low urinary tract infection, and to just sum it all up,